Hello and welcome back to Aging Well, monthly production of Somerville-Cambridge Elder Services. I'm your host, Nathan Lamb, and our topic for today is opioids and older adults. And my guests in studio today are Libby and Cassie, doing some great work in the community with older adults and opioids. And in this segment, we're going to talk a little bit about resources that can help. And you guys are very familiar with those things as well. Where would you like to start when it comes to resources?
Well, I think just to give an overview, so there are, if someone is addicted to opioids, the frontline treatment is what's called medication-assisted therapy, and that is supposed to be used in conjunction with behavioral therapy. And so medication-assisted therapy is medication that people take to reduce the effects of addiction, so while avoiding the effects of withdrawal. And I believe there is one medication-assisted treatment clinic in Cambridge, so right nearby, that's housed in the Cambridge Hospital. And so if someone is able to leave their house and mobile to go check in there regularly, that is a good local option if you are needing to get treatment for an opioid use disorder.
It's not a cold turkey type situation.
Yeah, absolutely not. The effects of withdrawal from opioids can be really uncomfortable. They don't have long-term lasting negative medical repercussions, but it's an extremely uncomfortable process, and really the way to start getting off opioids is through medication-assisted treatment. I don't know if you have anything you want to add about that.
Yeah, the state operates a helpline as well as a website that people can visit to get a sense of the lay of the land and where to go. There are also a lot of supports for family members, which I think is helpful for people to know if they have a loved one with a substance use issue. Learn to Cope is one, and they have meetings in the area.
Support groups,
all peer run. And another is Allies in Recovery, and that's actually free for people here in Massachusetts. You would go to the website, and it's a lot of online resources and videos, modules, and you go to the website, and then you can put in your zip code as the promo code.
Right.
And the sponsoring organization is the state of Massachusetts. So that's a good resource to check out as well.
That's really good for if you have family or loved ones who are using substances. It has all these modules and resources about how to talk to them and how to help them, and really how to be a supportive family member while also caretaking for yourself in that stressful time.
Absolutely. You mentioned peer run. For those who aren't down with the peer world, what does that mean?
So as that
for those who aren't peers.
Right. So that is led by and for people who are affected by this issue. So in the case of Learn to Cope, family members. There are also recovery coaches, and those are people that themselves have lived experience of a substance use condition and support others, on that experience.
I appreciate your work with our peer cluttering program, and I really saw the value in that when we were talking about that last year. So I thought that was worth pointing out, that it's kind of an interesting concept.
And Learn to Cope was started by a woman who lost her son to addiction, so it really comes from a place of lived experience.
I think particularly for a subject where there's so much shame sometimes or guilt, that having someone who has been there and can support you on that level is just so important.
Yeah. And sorry to jump, I just wanted to also highlight again the hotline that Cassie mentioned, because you can call and ask for substance use resources in your area, and you can go online. And so wherever you might be in the state, they can point you to the right resources. And I know we mentioned medication-assisted treatment. I also just want to mention that getting individual substance use counseling or group substance use counseling is also really important. And for folks in the area who might not have access to transportation or be able to leave their home for a variety of reasons, my organization, the Institute for Health and Recovery, offers in-home therapy and counseling. So if there's anyone watching who is interested in getting that service, they can call our main number and get into the referral process.
Oh, that's great. So we talked a little bit about what's out there. In terms of advocating and more help and what happens next, are there any advocacy efforts that people can get involved with or follow that can help do more with this issue?
Sure. Actually, Nora and I were at the State House recently providing some testimony around opiate use among older adults. I think, as we've discussed, there still is just this misconception that it's a younger person issue, and that ageism can sometimes prevent people from getting the help they need. And we always are advocating for services to come to people in the home, which we think is so important with an aging population.
Absolutely.
Yeah, I mean, I think part of the purpose of the project I'm working on is to raise awareness and also gain more information about this issue, because most research does not focus on an older adult population. So even research on, the prevalence of opioid in women, often that research has an age cutoff that doesn't include older adults. So, part of our purpose in this project is really to raise this issue to the level of awareness and get more information so we can have suggestions around appropriate prevention efforts and treatment efforts. I think on an individual level, a point of advocacy is, talking with your doctor. I think a lot of prescription misuse starts with the doctor. If you're worried about your opioid medication, if you have questions about it, if you want more education from your doctor, I would say advocating for your, right to that information is a really great place to start.
Yeah, absolutely.
Also, if you are someone that goes to talk to your legislators, which I encourage everyone to do, tell them that this isn't a problem that affects older adults too.
Yeah.
Or if you're a member of the amazing Mass Senior Action Group, talk to people there and say, this is an issue that's important as well.
Absolutely. So we're almost out of time. I just want to ask if there's anything else you want to add on this topic before we wrap it up.
I would say if you are someone that wants to go to a group, say you want to go to AA or NA or one of those groups and you can't get out of the house, you can always call and see if they have the capacity to come to you, because sometimes these groups can hold a meeting in your house or hold a meeting in a place that's accessible to you. So just encourage people to ask for help. That is, one of the hardest and most important steps.
That's great.
Yeah. And just going off that, I would say, if you're worried about yourself or a loved one, that is okay. Addiction is a disease and it's nothing to be ashamed of, and there are resources out there. And so I think just, having an awareness that opioid misuse and addiction can affect anyone of any age is really important, and to reach out for help.
Well, I'm glad we've been able to help spread that message a little bit today. I'd like to thank both of you for joining us again. Thank you so much.
Thank you.
Thank you.
And that's all the time we have this month for Aging Well. We'll see you next time. Thanks.